being the smartest person in the room, right? Get rid of that. It's all about resilience. Resilience to run mini micro experiments to stumble upon what actually works for this patient population in this setting with these resource constraints. We've got to show all members of the care team that not only do they need to step up, but we've got to run experiments. Some of them are going to work, a lot of them are going to fail, but we pick ourselves up and we keep going, and that's the way we save primary care. So a couple last quick ideas, because I know we're running out of time, about the notion of creating change. And I'm going to go a couple more minutes over. I'm sorry. Forgive me. So how do we help teams take on really big problems? Not just care teams, but movements, cities, communities. How do we help them do remarkable, seemingly impossible things? Well, in the world of community organizing, we're always asking the following questions. Who can fix my problems? What do they care about? And what resources do I have to leverage to get them to fix the problem? So who's the dean that can create a curriculum? Who's the hospital policy leader who can make a change in reimbursement? Who's the human being at the other end of this problem? A human being with interests, with fears, with motivations, right? And what are their buttons? Because we've been taught in healthcare that data is all we've got, that our white coats are the thing that gets it done, right? That our credibility is the thing that moves. But that's just some of our power, and I don't even think it's the most significant. And why do we need to do this type of thinking? Because we have big problems to take on. We will only be able to fix these big problems if we think about all of our resources. But also, we need to do this because it's a revitalizing action to start saying, I actually have power. I actually can affect change, right? This huge institution, this medical school, this hospital, whatever it is, my relationship with it is not immutable. It's not fixed. I can dance with this institution, especially if I work with other people. A couple years ago, I went to Stewart. And I basically said, he's the medical director of our practice, I said, Stewart, you got so many more resources here at this practice, at this medical home, than any other Brigham-based practice. How the heck did you do that? And he said, I woke up one day, realized the game changer moment we're living in, and I stopped thinking that I was a victim. And what he means is, you know, Stewart for years had really felt like a victim. And when he went to speak to the higher-ups, he would show that he was a victim. He would talk about his problems, and he would try and get them to care about it. But it didn't work. But then one day he realized, wait a sec, this is an ACO. They have a financial stake in terms of controlling the utilization of the population. They need me. So he went into that office that time and didn't talk about his problems. Who cares about his problems? He went in and talked about their problems and his ability to fix their problems. And he got the money he needed. And if you look around the country, you're seeing examples of this all the time. Our community is no longer talking about our problems and trying to get people to care about them, because no one cares about our problems. They care about their problems, and if we can solve their problems, they're ready to talk. And there are so many different ways we can do that right now. Think about the context that we're living in, right? The Affordable Care Act. Millions of Americans have now gained coverage. This act will not be seen as a success if we cannot couple coverage with access. They need primary care. We got to leverage that. Institute of Medicine just released this report on the financing and governance of GME. They basically said to teaching hospitals, if you don't start turning out more primary care, your money's going to get cut. They need us. They need primary care. We can leverage that. Elected officials, right? They're presiding over Medicare and Medicaid budgets that are getting killed right now. They need to control spending. They need robust primary care. They need us. We can leverage that. And finally, hospitals, right? All these places forming ACOs, most of them cannot survive without robust primary care. They need us. Come with us if you want to live. You want to get out of here? Talk to me. Choose your statement, but that's the point we got to get across. That's our power. That's this moment. That's organizing. But there's one more form of power, friends, that we have to think about. And it's this. It's our relationships with our patients. Some of us have actually started viewing patients as partners in terms of the endeavor of improving how we deliver care. Right? Nothing without me, nothing about me without me is the phrase. Right? We're engaging them. How do we improve care delivery? How do we make this more patient-centered? That's great, but it doesn't go far enough. We have to partner with patients to advocate for the resources that we need to get patients that care that they want and deserve. Innovation without advocacy to get the resources needed for that innovation, it's like an engine without fuel. It will sputter and stop. We have to advocate with them. They are totally untapped. And that means we have to really start building a new type of partnership with patients. And we're going to have to figure out how to do that together. But I believe in my heart that we are not going to be able to save primary care fully until we start working with patients in that way. So, we've talked about story. You've all got a story. It's a leadership tool. You can use it to connect. You can use it to create a new sense of team. You can use it to enforce and establish culture. We've talked about the importance of creating interdependence and dispersed leadership on your teams, getting people to step up. We'll never have the capacity without it. We talked about being strategic when we're taking on problems, thinking not just about the technical plan, but also who can give us what we want, what do they care about. We exist right now in a 100-year healthcare revolution, right? We are right at the tip of it, right at the point, right in the vanguard. An incredible opportunity has fallen into our lap, right? More and more healthcare stakeholders are investing in primary care. They're putting real money down. That gives us a tremendous opportunity. And I think it's really exciting that a lot of members of our community, the primary care community, are starting to think about all the different tools we have at our disposal, including grassroots advocacy, community organizing. Because that approach to change has delivered so much in so many other domains of life. And I'm really excited and hopeful. And I believe we also can do remarkable, seemingly impossible things together. But at the end of the day, we have to know, everyone in this room has to know, that there is no cavalry that's coming to our rescue, because we are the cavalry. Thank you and have a great conference.